Hello and welcome to the A New Day show. I am your host, Dynamic Daphne, and I'm super excited about this episode today. Joining me here in the studio are three doctors, and we have decided that today's segments will be on healthy choices. To my closest right is Dr. Arthur Klein, who is a chiropractic doctor. In the middle is a Dr. Deborah Dixon, who is a naturopathic physician. And at my far right is Dr. Jack Levine. Welcome to the show. I am so excited that each and every one of you have took the time out of your busy schedule to join me here. But more than joining me, you have made a decision that you want to add value and to invest in my listenership, and I really honor that. And because we are just two women here, I'm going to choose to have Dr. Gibson introduce herself and tell us a little bit about you and as much as you want us to know about what you do, please.
Thank you, Daphne. I'm a naturopathic physician, and that means that I have been trained to be an expert in natural medicine. I've been in practice for almost 30 years and have a general family practice using the tools of nature, using nutrition and biochemistry, lifestyle modification, homeopathy, which is an energy-based medicine. We use botanical medicines derived from herbs, to help people to attain balance, to heal systemic issues that have occurred because of, sometimes because of poor lifestyle choice, or because the systems that help to create health issues have ceased to function in a harmonious way. So it's a very fulfilling kind of work. I've enjoyed every moment, and I enjoy giving people the power to take responsibility for their own health. That's part of my role.
Wonderful. I can see it's more than a practice for you, because I watch your expression as you speak about it, and I can see that whatever you're doing, you do with a passion. So we're happy that you're here. Dr. Levine, would you please introduce yourself?
I'm Jack Levine with a practice of holistic dentistry in New Haven, Connecticut. And my training, more than 40 years ago, was in allopathic dentistry, regular traditional medicine and dentistry at dental school. When I left there, I became interested in preventive dentistry and a different approach to the kind of work that I do. That approach today, and for the last 30 plus years, has been one of a biological dentistry and behavioral dentistry. So that means that the biological piece is one in which we have a practice that's devoted to non-toxic materials. And the role of comfort and environment and herbs and natural products that we use in the field of dentistry. The behavioral piece, I think, supersedes and comes before the biological part of dentistry. That to me is a delightful passion. I think it's based on a relationship-based practice. It's about people making choices that come from far and near to choose our practice because of what happens there. They learn about their health. They learn to stay healthy. They learn to care for themselves. Can you imagine what a toothache and bad gums is like in terms of your ability to go to work and sleep at nighttime, and send your children off to school. Once those things are fixed and they're healthy, it's more about taking care of yourself. The business we're really in is called self-esteem.
Wonderful.
Okay? Where we create an opportunity for people to feel better about their own smile. Thank you.
Thank you. Dr. Klein, would you please introduce yourself?
Sure. I'm Dr. Arthur Klein. I'm a chiropractic doctor in New Milford, and I've been in practice for 32 years. And I practice chiropractic health care. Chiropractic is just that. It's health care. It's not sick care. And we help people using non-drug approaches, primarily through the spine, by optimizing the spine and nerve system. And chiropractic is the largest drugless healing profession today. It was first developed in 1895 in Davenport, Iowa, making it the only healing method native to America that's still in wide use today.
Wonderful, wonderful.
Yeah, chiropractic healthcare is licensed and recognized by the federal government, every state, countries around the world, Medicare, and many sports teams utilize it. The Olympics utilize chiropractic care, because what it does, it helps to restore balance in your body. And most illnesses are from being out of balance or stress on your nerve system, brain and nerve dysfunction. So by optimizing nerve and brain function, we restore balance and alignment in your body. It creates an environment inside your body to heal and repair.
You know, I listen to all three doctors introduce themselves, and I look and I observe the passion in which you practice what you do. But not only the passion, you are a walking example of what you practice and what you teach, because I hear all three of you mention all these grand amount of years that you have been practicing. And I'm saying, my God, look at these young folks, healthy looking folks. So thank you for your willingness to share with us
You're welcome.
about that. There are natural ways in which we can prolong our life and a healthy life.
Thank you for noticing how young we look.
Okay?
Listen, and whichever one of you want to take the question I'm going to ask, you can take it and then I'll pass it on to the next person. Why did each of you choose this path? Why you decided that you wanted to go down? Because it's a non-traditional route, and it's hard work. So why did you choose to say, well, this is the kind of practice that I want to get into?
Well, I'll start.
Yeah, sure.
Okay. When I was in college, I wanted to be in the healthcare field, and my own natural ideas were forming at that time. And someone told me about chiropractic care. I didn't really know much about it, but I looked into it, and I realized that it's something that fit right into my own philosophy at that time. I visited several local practitioners. They referred me to the college, so I went out to New York Chiropractic College at the time in Long Island, and I found out that it's not just about helping pain syndromes. That's a part of it, but it's also about helping people optimize their wellness, getting well, staying well without drugs. And I'm not anti-drugs, but I am anti-overuse of medications. And your body has the ability to heal itself.
That's right.
And everything.
It's about
That's
education.
that's a principle that your health is based on. Everything we do in our office is based on that same principle. It's
Wonderful.
allowing your body to heal and repair.
Dr. Gibson, as you think back, why did you choose that path that you're now on?
I was fortunate in having a grandfather who was a pharmacist, who very strongly believed that the future of medicine lay in the direction of nutrition and biochemistry. And his daughter, my mother, also had a very strong interest in nutrition. And so it became an interest of mine as well. When I went to college, I was interested in becoming a medical doctor who used nutrition in my practice. But when I researched medical schools that would teach me the level of nutrition that I wanted to use in my work, I found that there were none. And so I researched more, and I found the School of Naturopathic Medicine that I attended in Portland, Oregon. And it was exactly the kind of healing that I wanted to use in my work. I learned at the Naturopathic Medical School about the additional benefits of using botanical medicines and homeopathy and lifestyle modification and counseling and the array of tools that we have available, and have never looked back. It was,
Wonderful,
yeah.
wonderful. Dr. Levine, you kind of touched on it in your introduction, but are there any other areas that you want to highlight as to why you went this route?
Well, I think I approached it from the fix-it, broken side. I approached it from the technical side. Dentistry, for most of us, is a technical handcraft profession. And I soon realized that people continued to get sick unless they knew how to take care of themselves. And I enjoyed my work so much that I go to work every day feeling excited,
Yes.
Loved. I have friends that are my clients. We don't call them patients that get fixed with a
Yes,
tooth, you know?
yes, yes,
And
yes.
so it's led me to a field of public health that I've also been doing for 20 years now.
And I listened to all three of you, and it just affirmed my practices and my principles about educating humans that we have the power to take care of our bodies and to help our bodies heal. And I'm from Jamaica, and I know there are sections of Jamaica where people can't afford to go to the regular traditional dentists or even the doctors and things like that. And I a couple of weeks ago, I was speaking with someone about growing up as a child, and I said, I remember we call it a kerosene pan, which is the container that you go to the Asian market now and they sell the cooking oil in. And my parents used to buy that from the Chinese store, the empty pan, and they would use it to cook their meals when they go out to do the farming in the field. However, that's the same container that they would boil the herbs and roots in. The only measurement I knew was that the pan was filled with water, and it is ready when it's boiled down to a quarter of the container. And I grew up knowing that those were the natural things that helped them to live a long, healthy life. So it's good to now to see that this is still alive and that the information is available to those who desire it. As you look over your practice, Dr. Gibson, how challenging it is, if it is, for people to accept and embrace the teachings?
I think of myself as an empiricist, meaning that I test the methods that I work with and I see what is successful. And I expect that my clients, my patients, will have the same approach to healing. And so whether someone is the most ardent enthusiast for natural medicine or the most ardent skeptic, what is really going to make them, if they can, be encouraged to try natural medicine, what's going to convince them of its efficacy is by trying it and seeing how they feel, seeing what happens in their body, mind, and spirit as they make changes that are in alignment with the way their bodies were meant to function.
So it's really a holistic approach. It's not just one thing. It's like wealth and it's like success. It's not one component. It's a combination of things. Dr. Levine, how do you introduce natural dentistry to a community? Because people are quote unquote accustomed to habits. That's you have a toothache, you go yank it out, and
Right.
How do you introduce? How you started? If you can look back way back when,
Sure.
how did you introduce
I
that?
think it's important to have a foundation of evidence-based treatments. So I rely on research, I rely on products, I rely on tested materials and tested approaches. But what's important in our work and in the practice of holistic dentistry is honoring the patient's choice. So if a patient says, you know, I'd rather do it this way, or I understand what you're saying, but that doesn't fit for me, or I'd like to do this, but we have to go slowly because I don't have a lot of money, or I have a way at home that my parents told me about that's a more natural healing. I don't know what it is, but it works.
That's right.
Well, I honor that.
That's right.
We honor their choices. We also create an environment in which people are receptive to new ideas, new products, new way of dealing. I believe that people come to any practitioner with a little recorded message in their head, and the name of that message is called earlier and similar. That means I've been to the dentist before, so this time is going to be similar. And it's my job to break that tape.
That's right.
To bust
Erase
the tape,
it,
to
yeah.
erase it, to have a brand new experience,
So you can come in.
to
It's all about
create
the
something
experience.
that's
Wonderful.
unique.
Wonderful.
And then based on relationship, people will accept a new idea.
Trust. It's like
If it works,
respect.
and the evidence has to be there.
Yeah, what I like about what you're doing, you are communicating. There's a dialogue that's going. It's not about, hi, and you start writing and you
Yes.
get out of there. It's a dialogue that's going, and people are going to be more open and receptive to your recommendations. Dr. Klein, I know as a chiropractic doctor, it doesn't make yours any easier. And people are saying it's not what we are accustomed to. Of course, now it's more prominent and it's getting better. But as you look over your many years of practicing, can you remember what it was like back then to now? Because you have come a long way.
I'm not that old.
Not you, but the practice.
Well, things have changed, but even when I started out 30 years ago, there was no shortage of people seeking out natural, non-drug approaches. It was different to what they grew up with, but they're open to it. That's all there is to it. And most people who seek out chiropractic care, maybe you find the same thing, are at the end of their rope. They've already,
That's right.
They've tried many things. They don't know what else to do. They've been through sick care,
That's right.
and they finally figure out they want some health care.
And you know, Arthur, it's interesting that you said that, because it's really a shame, for want of a better word. It's a shame that we wait until we get to like the end of the rope to choose the right thing. And I think it's because society has us so programmed that if you're not doing things the traditional way,
Very true.
you're not doing the right thing. It's like spirituality and religion. If you're not doing what the next person is doing, all of a sudden they think, oh, you're New Age. And I oftentimes say to people, you need to become New Age too, because you're going to be better off. Because people are not embracing that which is new. People are afraid of change. So for those people who are receptive and embracing it, I just honor them and I applaud them for, just allowing their light to shine. What age can a person start utilizing chiropractic care?
Well, good question, Daphne. Any age can start with chiropractic care. You can get your spine checked at 1 day old. I checked my own daughter when she was 2 days old. I checked her spine. I would have checked her when she was 1 day old, but I was still kind of shaking from the whole thing.
I don't know why Hillary allowed you to do that. She should call somebody else.
No problem. Check your spine. We check a lot of kids. We see many kids. In fact, we have a
Yes.
family practice. We see
Wonderful.
many kids in our office.
Wonderful, wonderful.
And just like with adults, there's two types. Some come in with problems, and some come in to prevent problems. So you either want to get well, or you want to stay well.
We have around about 8 minutes remaining in this segment. So we want to tie this up because we are going to go into part 2, which we are going to be talking about more of the advantages and all of that. So how do you want us to tie this up? Dr. Gibson, I'm going to let you start. Why should people really look into practicing natural choices to both nutrition and health?
Well, if they want to address the underlying causes of most degenerative disease in our culture, if they want to deeply heal and not just treat symptoms, if they want to move away from the medicine cabinet full of pharmaceuticals with side effects that could take up a page of fine print, and use tools that are in keeping with their body's natural and preferred way of functioning, then that would be a good choice for them. If not, then there are other choices.
For someone who is hearing, Dr. Levine, for someone who is hearing about holistic dentistry for the first time, how do we start? What's the first thing we need to do?
I think the first approach is to make a self-evaluation, and then and there are many things that we can see. I think the first and obvious is bleeding gums. Gums are just like and very similar to the skin. If your skin was bleeding, you would seek attention immediately. If your gums are bleeding, if you take the toothbrush out and it's red, well, that's a need for attention, and then seek a qualified professional to assist you with that. That's the first self-diagnosis.
Does, and I'm going to come to you, Arthur, does insurance covers holistic dentistry?
Yes, if
Okay.
someone has medical insurance, it's for medicine, and we do
covers.
some medical procedures, but if they have dental insurance, then certainly it covers the examination, the cleaning, the periodontal care, fillings, and all of the things that we do for every dentist, that every dentist does.
Okay.
Yes.
Dr. Klein,
Yes.
for those people who have, and of course this is a return visit to you, and I know you came here and you told them all the advantages and everything, but there are still some people who are new to that and still are not doing it. What are some encouragement that you can tell them to get started?
Well, I would say there's always non-drug approaches. Natural health care should be tried, in my opinion, first. There's no side effects, safe. When people come to us, we don't treat their conditions. We care for them as people.
Yes.
So you get health, as I said before, I'm going to say it again, you get health care, not sick care.
Not sick care.
Right. So
Preventative, yes.
There's preventative, there's wellness care. Once we get them the help they need, then we put them on. We recommend a wellness program to keep them that way for life.
Okay. Wonderful. You have known me for a while, Arthur, and I know you have noticed some changes in me, because 2 years ago I made a conscious choice that I was going to modify my lifestyle. So I started eating differently, extremely different. I started eating majority raw and doing juices. And now people look at me and say, oh my God, you look like you're 25. So jokingly I said to a woman last week, I said, no, I'm 14. And I have so much energy. I feel alive. And I am more conscious. I am the daughter of a farmer, so it was not difficult for me to begin to eat close to the ground, as I choose to put it. Because I didn't grow up on meats and all of that. I grew up on peas and beans and vegetables and a whole lot of it. So for me to go back, for example, this morning, my green juice for breakfast was the juice from celery and baby pop choy and kiwi, some fresh ginger. And there's another vegetable I buy in the Asian market. I don't know what it, every time I go and I see something, it's on long stalk. And that was what I juiced this morning for me. And then some of my friends look at what I'm drinking and they say, oh, what's that? And I say, oh, it's such and such, because I have such pride in what I'm putting in there. So I'm here to tell people that it is to your best advantage to really make alternative natural choices to your lifestyle, because if we continue to depend on the pharmaceutical, and even a lot of the research is out there, it depends. I know the results we are getting depend on who fund the researches, and that's another show for another time. So, but people must look into that. We have 2 minutes remaining. One word of caution from each of you. You can look in that camera and just tell the audience what word of caution you want to tell them before we end this episode.
Oh, a word of caution.
Yes.
All right.
Better food choices, maybe?
Well, sure. Yes. I mean,
better food choices?
you will either invest in your wellness or you'll invest in your illness.
Perfect. That's it. Invest in your wellness or your illness. Arthur?
Well, again, natural methods. Healthcare, not sick care. You can wait for a problem. You can treat symptoms. Natural methods and not symptom care.
Wonderful. Dr. Levine?
Your wellness changes from day to day, so you need to check in with yourself and seek the proper help, and we wish you live the longest.
That's right.
The
That's
longest.
Right. That's right. And for those, from me, for those of you who have been watching me for a great number of years on the show here, you can look at the new me, the transformed me, and you can know that these natural things are working. And I'm not even utilizing Dr. Gibson's things yet. I'm just doing my thing by myself. So you see I look fabulous. So it's about time that you make the decision that you want to take care of yourself, because if you want to live a long life, it depends on your choices in life. It's a paradigm shift. It's all up to you when you decide that you want to make a difference. Remember, your life is in your hands, and you can make the decision whether it's going to be long or short. See you in episode 2 of Natural Health Choices.